All right, my name's Megan, and I'm gonna do my final lab pass off. So I'm gonna go to my med room. I'm gonna gather all of my supplies. I checked the EMR, and I noticed that she's due for her ciprofloxacin, which is an antibiotic. And I'm gonna grab that. And then I'm gonna make sure that I grab just one medication per one patient and make sure that's taken care of. I'm gonna grab my scanner. And then she also needs a straight cath done. So I'm going to grab my catheter tray, some wipes, a couple extra pairs of sterile gloves, and then alcohol swabs just because. Okay, so then I'm gonna come over to the patient's room. Okay, so I'm gonna double check. I probably should have taken my computer with me just to make sure that I grabbed the right medication. So it's the ciprofloxacin, and I need 500 milligrams oral by mouth, and it's for her gastroenteritis. So I'm going to make sure that I have the right patient, the right dose. So my patient is going to be Miss Sally Jones. I have the right patient, I have the right drug, ciprofloxacin. The right dose is 500 milligram. The right time is going to be administered right now. The route is orally, and then everything looks good. Okay, so I'm going to go into my patient's room. Hi Sally, how are you today? Oh good, I'm so glad. My name's Megan and I'm going to be your nurse, okay? Alright, can you verify your name and date of birth for me? I'm just going to grab your Sally Jones. Perfect. Alright, that's exactly what I have in my chart. Good. Okay, Sally, do you have any allergies that I need to be aware of? Okay, so that is one allergy, oxycodone. Okay, alright, that's good to know. I'll make sure that that's in your chart, okay? Okay, do you have any allergies to latex or anything like that? No? Okay, good. So we have a couple things that we're gonna do for you today, okay? I have your medication, your ciprofloxacin, and that's gonna be for your gastroenteritis, okay? Yep, so that's gonna help you with that. So I'm gonna grab that real quick and get that ready to go, and we're gonna give you that. And then I'm gonna perform a baseline assessment, which is just gonna do a general check on your whole body, make sure that everything's looking good, okay? And then after that, we do have to do a straight cath so we can get a urine sample down to the lab. Yeah. Okay, I'm just gonna do a general safety check of the room, make sure there's no loose cords, nothing that I need to be aware of. Everything looks pretty good. Her IV line looks good. There's no redness, no bruising, no swelling. It's currently locked right now. It's a saline lock, so there's nothing that I need to worry about that. So I'm gonna hurry and get her medications all figured up. Okay, so I'm gonna scan your barcode, okay? And you already verified with me who you were. Patient barcode does not match. Are you really who you say you are? Are you really Sally Jones? Because this is telling me otherwise. So, I'm in the right chart. I am scanning patient's barcode. And for some reason, it's not wanting to go. I think it just froze. So, let's try that again. Okay, we're gonna try and scan one more time. Okay. And then we're going to scan medication. Okay, good. That one went right. Okay, and then our dose is 500 milligrams. Okay, so I'm going to double check that. And one medication for one patient at a time. Okay, the route is orally. It says orally right there. And then the time is right now. Okay. All right, you ready to take your medication? Okay, we're gonna have you sit up a little bit, okay? Okay, how's that? Is that all right? Okay, ready? Here we go. Okay. Here's a sip of water for you. Good. Did that go down okay for you? Okay, excellent. All right, Sally. Okay, I'm gonna lay you down just a little bit, okay? All right, so now we're gonna do our baseline assessment, okay? Okay, so what we're gonna do now, I'm actually going to make sure, so I did my 3 checks. I did it when I got it from the room, when I was preparing and pouring it, and right before I gave the medication to the patient. I checked their birth date, and then I administered it. So I'm going to put that I administered that medication. Okay, and she took it well. All right, then next we're going to check your eyes. Okay, I'm going to make sure that your eyes are doing what they're supposed to. So I'm just going to shine a bright light. Okay, just look straight ahead. Good. Great. Okay, and then you're going to follow my pen, okay? Just with your eyes. Good. Good. Excellent. Perfect. Okay, so your eyes are what we call perla, which means that your pupils are round and reactive to light. They're equal and they have accommodation, okay? Yep, I know that's a lot of big words, huh? All right, so then what we're gonna do next is I'm gonna just feel for any lumps and bumps. Have you had any pain in your head? No? Okay, that's good. Okay, I'm gonna take a look in your nose. Okay, and in your mouth. Good, I'm gonna look in your ears. Excellent. Okay. Have you had any nausea or vomiting or anything like that? No? Okay. And I noticed that the CNA was just in the ended your vital signs. You said that you were alert and oriented ×3, so you could tell us where you were and all that. Okay, that's great. That's what we like to hear. There's no confusion. Okay, so next what we're gonna do is I'm gonna just take a look at your chest, if that's all right. Okay, the skin looks well, good contact, nothing crazy. All right, is it okay if I listen to your heart now? Okay. All right, I'm gonna look and split aortic. Good. Pulmonic. Okay, Erb's point. Tricuspid. And then the mitral valve. I'm gonna listen here for 1 minute. Okay, good. So got that your pulse was 78, which is what we got earlier, okay? Yep, that was great. Okay, and then have you had any like palpitations, like where your heart races really fast, or any issues with that, any chest pain? No, good. Okay, that's great. Okay, so next we're gonna move on to your lungs, okay? Do you ever have difficulty breathing or wheezing? No? Awesome. Okay, So I have 6 places that I'm gonna listen to on your lungs, on the front, and I'm gonna have you sit forward, and I'm gonna listen to the back too, okay? Okay, so I'm gonna have you take a deep breath. Good. And another deep breath. Good. Another one. Great. And go again. Good. And then again. Okay. And one more. Good. Okay. And then we're gonna have you sit up. Okay, ready? Is that okay? Okay, good. Okay. Okay, ready? Deep breath. Good. Deep breath. Deep breath. Good. Deep breath. Okay. Deep breath. Okay, and last one. Great. Okay, your lungs look really good. And I looked at your back as well when you were sitting forward, and I didn't notice any breakdown on your skin or nothing like that, okay? So that looks great. All right. So next what we're gonna do is I'm gonna look at your abdomen, check to make sure that everything's doing okay down there. Yeah, I know that you've been having a lot of pain. So we're just gonna take a look at it, okay? I'm gonna lay you flat if that's all right. Okay. All right, I'm just gonna roll this forward. Okay, so I don't see any skin breakdown. The skin looks really good, looks intact. No bulging or distension that I'm noticing. Okay, is it okay if I listen to your bowel sounds? Okay. So I'm gonna listen to the 4 quadrants. 1. Okay. 2. Good. 3. Okay. And 4. Okay, good. So you do have active bowel sounds, which is great. We like to hear that. Okay, is it okay if I push on your stomach a little bit? Okay, ready? Any pain there? A little bit? How about here? No? How about here? No? Right here? Just a little bit? Okay. All right. That's good. Everything looks really good, okay? All right. Now I'm just going to take a look at your skin, okay? Make sure that you don't have any skin breakdown or any cuts or bruises. Okay. That looks really good. And that looks really good. Check your IV site. It looks awesome. Okay. I'm just going to feel your radial pulses. Make sure that they're equal. Okay, they're equal. And then will you squeeze my hands? Good. And then I'm just going to check your capillary refill. Perfect. Okay, that looks great. I'm just going to take a look at your legs now, okay? Okay, legs look good. I didn't notice any swelling or edema in her hands. I'm going to take a look at her feet now. Okay, no swelling. Good capillary refill. Okay, no swelling. Good capillary refill. Okay, will you push on my hands? Good. Okay, and then push. Okay, good. Everything looks great. And I noticed that you were up and ambulating in the hall earlier today, and you didn't look like you were struggling at all with walking. Do you have any issues with foot numbness or anything like that? No? Okay, good. Everything looks great. And then there's no tubes coming out of her, no catheter or anything like that, so we don't need to check on that. I did check her IV already, and it's not hooked up to anything, so we don't have to worry about that. I see that she drank all of her breakfast this morning, which is excellent. Okay, so now what we're gonna do is I do have to do a straight cath, okay? So that's just, so what we do with that procedure is it's just a straight catheter. So it's just like a little tube. It goes in, I get enough of a sample out that I can take it to the lab, and then we run it and make sure that you don't have a UTI because you were having symptoms of a UTI earlier, okay? Yeah, so it shouldn't be too bad, okay? It should go pretty smoothly, and it doesn't have to stay in. It just goes in really quick and then it comes out, okay? It might be a little bit uncomfortable for a minute. Yeah, it's not fun, but it won't be awful, okay? So I'm gonna lay you down flat. Is that okay? You comfortable like that? Okay, good. So what we're gonna do is I'm just gonna drape this down, try and keep your privacy as much as I can, okay? I'm gonna put your legs like this. Dorsal secundant position, okay? Is that okay? Okay, good. and then I'll keep you covered just until I get all my stuff ready, okay? All right, I'm gonna grab some gloves. Okay, so first off, I'm just gonna clean it up, okay? And I'm actually gonna switch sides. Yeah, I'm right-handed, so it just makes it easier. Maybe this goes up. There we go. Okay. Let's see how this goes down. Okay, and then I'm guessing this goes up. Do you have any questions or concerns before I start on this? Okay, do you have any allergies to iodine or anything like that? No? Okay, good. Sometimes we use iodine to sterilize it. Yeah, that's all. Any allergies to latex? Good. And then did they tell you the side effects of your ciprofloxacin? Okay, so sometimes you might have like some muscle spasm, interesting things like that. You just gotta watch for that. Make sure that you're doing good. Okay, so now we're all clean there. Okay, just grab my supplies. Sorry. Okay, so this is just a sterile drape that's going to go underneath you, okay? Stay careful with my gloves. I'm just going to get some new gloves. then I forgot to ask you when I was doing your assessment, did you have any pain? A little bit on your stomach? Okay. So does anything make that better? The medication that they've been giving you? Okay, that's good. Have you tried like any other like rice bags or anything like that? Okay, and is it just on that left side? Yeah, okay, so it radiates on your left side. Okay, and when did this pain start? A couple days ago? Okay. All right, well that's good to know. Okay, and then I'm just gonna bring this over to us. Okay, we have our specimen cup. I'll make sure and label when we're all done. I should have put this drape on before I put my tray there. Okay, and then we have some lubricating jelly that I'm gonna stick on the catheter. And I want to watch what I'm doing with this so that it doesn't touch anything that it's not supposed to. Okay. All right, so I'm just gonna clean you with some swab sticks, okay? And I noticed that when I threw that last thing away, I probably dropped Sterilfield because I dropped it from below my waist, so make sure not to do that next time. Okay, so what we're gonna do is I'm gonna get my swab sticks ready, like this. Okay. All right, it's gonna be a little bit cold, okay? Yep. So what I'm gonna do is I'm gonna use this hand and I'm gonna separate your labia and we're gonna get it cleaned, okay? So we're gonna clean the outside first. And then we're gonna clean the other outside side. Okay. And then we're gonna go right down the middle. Okay, good. All right, and then I'm gonna have you breathe, okay? We're gonna get this sample. Okay. So I'm going to grab this. Okay, ready? Okay, deep breath. Here we go. Just until we start getting flow of urine. Okay, I'm gonna hold it in place so I can get the sample. Okay, good. And then I'll grab out my sticker so I can just let the urine continue to flow in there. Okay. Alright, then we're gonna pull that out. Okay, good. Alright, and then I'm gonna grab some wipes and I would clean her just to get all this stuff off from what we were doing. Clean up all this stuff. That was a wipe, we would just clean it off, get all the jelly off and stuff like that. Okay. Alright. And then I'm going to date and put a name on this and then make sure that I take it down to the lab. All right, how was that? Is that okay? Okay, good. All right. Let's get you back healthy. This goes down. So, I would lower the bed, but I don't know how this one lowers. So, I would lower it to a safe height. Oh, maybe it's just, there we go, okay. All right, can I help you with anything before I leave? No? Okay, we checked your tubes, did a safety assessment. There's nothing that you can trip on. We got your urine sent down to the lab. We gave you your medicine. Yep, and I would check to make sure that there weren't any side effects. Are you having any side effects from that medication? Or are you feeling okay? You're feeling okay? Okay, good. All right. Well, then I think we're done, Miss Sally. Let me know if we can help you with anything, okay? Okay, thank you.